Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. This is the second video in the Q&A installment that I just started. This series are focused primarily on answering your direct and your specific questions. So if you do have a specific question that you would like to get a specific answer to, please comment below, leave your questions below. You can also email me. My email is in the description bio, and that way I can include this in a video series. This is a great way to get an answer more tailored to your particular struggles, more tailored to your particular challenges right now. And as we often know, if you struggle with something, chances are somebody else is struggling with that too. So it's really helpful to everybody else. As always, keep in mind that if your question is diagnostic in a sense of, hey, Dr. Z, can you tell me if I'm transgender? Or can you tell me if, for example, what I'm struggling with is not gender dysphoria, but maybe generalized anxiety? I'm unable to do that because not only is it not ethical for me to do that without knowing your history and working with you, but it's just not very smart to do. So as far as up to this point, the questions have been fantastic. They have been very broad in nature, touching on subjects of regret, misgendering, coming out, dealing with gender dysphoria, moving forward, moving past fears, how to get started. And these questions are really, really great because not only am I able to answer them, but I'm also able to give you a more specific answer tailored to your questions. So I have selected 5 questions for this video, just as I did for the other one. 5 seems to be just the right amount. I have blocked out the names of the individuals who have asked the question, so that way your privacy is intact. But if you ask this question, you recognize it as I will be projecting the questions on the screen. So let's get rolling. So the first question: hello, thank you for taking questions. By the way, my pleasure. I'm really enjoying this Q&A series because I love this direct and specific type of concerns a lot of you are having, and being able to offer you some of my knowledge and expertise, and hopefully for some of you that's going to really help. I am female to male and wondering how will I ever be able to fake, interesting choice of words, being socialized in a boy way. I don't think I can communicate to other men normally, okay? I just don't understand their code, and it makes me feel fake and sad about my lost childhood. Is there anything I can do besides just trying to assimilate if I don't want to be out? This is a great, great question. And I have a lot of people ask me this, something along the lines of, how can I really be my authentic gender if I lack that gender history? Just like you said, how can you really be able to be there if you feel like you don't have the man code? So the reason why this is such a great question, because there's a lot of myth and there's a lot of BS in our perception of individuals who were assigned and comfortable with their gender at birth, being able to, through their life of experience, accumulate some kind of a stereotypical code or stereotypical constrained experiences that's specifically tailored to that. And that is simply just not true. Anybody who has been assigned male at birth and been comfortable presenting in their masculine gender throughout their lifetime, sure, there are going to be certain elements of accumulation of experiences in relationship to other men and other guys and other masculine individuals, but each experience is still nonetheless is going to be different. There is no particular way to be a man. There's no particular way to be a woman. There's no particular way to be a non-binary person. There's no particular way to be a trans person. There's just a way for you to be you in relationship to your gender. Now, we have wealth of literature and movies and even cartoons and media and magazines and images that would like us to believe and continue to tailor the stereotype that these are men's experiences and these are women's experiences, and this is the experience all of the boys go through, and this is the experience all of the girls go through. And the truth is, no, that's not true. Not only is it not true, because what we're being saturated in the United States with is just Western experience. People who identify as women or men in other cultures have different experiences of what the gender really symbolizes and signifies in their culture and in their society. So, as I always say, for me, for example, I am a woman, I identify as a woman, I'm very comfortable with my gender assigned at birth. Can I say that I accumulated all of this experience that now stereotypically puts me into some kind of code to be able to communicate to all women? No. And in fact, I don't even get along with most women, or I don't even prefer relationship with women, because I prefer relationship with men, because I tend to find my conversations and the fact that I'm very direct to be more interesting and more in flow with those individuals. Not to say that women can be direct, but I often seldom find them. So there's no necessarily particular code. A lot of people feel like they have missed out on something. A lot of people feel like they don't have those experiences. This is what I always say. A lot of you who have gender dysphoria have been struggling with gender dysphoria very early on. So early on, your subconscious, and Julia Serrano also talks about it, where she talks about subconscious sex, although I see it a little bit differently. Your subconsciousness, your internal self, has always seen you as a masculine self. Transition, what it offers you is now to make you external in order to make you internal. But your internal experiences have still been, even though you've been socialized and acculturated a particular way, there's psychically you still resonated and connected more to the masculine self. Your masculine self is your masculine self. Now, you may think that there is a particular guy mode, but there really isn't. And if I were to ask a group of men, is there a man code? I'm sure they will probably tell me, yes, there is. And that code, if you were to hear what they were going to say, would be just a stereotype of activities that we associate with guys. The same thing for any other gender. It really is a cluster of stereotypes that we socially, culturally got to associate with that particular gender. So truth is, all of us, regardless of gender, even people who are very comfortable in their gender assigned at birth and cis-identified, all of us are not always comfortable or not always in resonance with gender roles or gender expressions. And I bet you even a lot of guys who are comfortable with their masculine gender assigned at birth, who have always socialized, as you mentioned, in men groups, they would tell you that a lot of things that stereotypically people tend to do doesn't make sense to them, because everybody is highly individualized. Sometimes we just do things because we tend to be in groups and because we want to conform and we want to be liked, so we go along, but that's not always us. So you have to realize, first and foremost, the part of your equation has a lot of stereotypes embedded in it. There's no such thing as particular way of being socialized. Sure, the experiences of somebody who's been always socialized as a guy versus a girl versus non-binary person versus trans person is going to vary, but nonetheless, a lot of experience carry the baseline of the same feelings we all feel. And all of you are going to share that. So I would really, really encourage them, and I have people ask me this type of question, I really encourage them to drop the shed of conception, this ideas that you need to have those experiences in order to validate your masculinity, because your question does have to do with a sense of validity. You're basically saying, I feel untruthful, I feel fake unless I have those experiences. And you don't really need those experiences to feel truthful to who you are. Now, what I can say for sure is that the more you do spend time in the groups and circles of individuals whose gender mirrors your gender, so for example, with a whole bunch of masculine identified individuals, the more you spend time with them, what's going to happen to you is the more you're probably just going to start take on a lot of group behavior and group phenomenon. And on the surface, it may look like you're assimilating, but really you just kind of taking on a lot of stereotypical behaviors that a group dynamic tends to display. So, this also idea that lost childhood, I would encourage for you to look at it differently, because like I said, psychologically, there was always a part of you that has a resonance of masculinity. This is why right now you have gone through transition or maybe going through transition, and right now identifying the way you identify versus your gender assigned at birth. So keep that in mind. A lot of people, they just innately know that they have always carried that aspects of themselves throughout their lifetime. So really encouraged to drop this idea of stereotypes. Otherwise, it's just going to continue to make you feel like you're inferior. It's going to continue to make you feel like you're an imposter. You are, every time you're going to meet in a group of your friends who are masculine, every time you're going to meet, you're going to start nagging inside within your head space, wondering whether you fit in, or, oh my God, I don't have this experiences to talk about. You don't need those experiences. What you need is where you're at right now. And really, all you need is good relational skills. That's all we all need when we're socializing. So hopefully that answers your question for you. Second question. How would you recommend a non-binary person or someone early in transition navigate using public washrooms, public restrooms? I basically stopped going anywhere without accessible individual toilets, but that is not sustainable. I agree. My friend told me that his therapist said that non-binary people don't really have a right or wrong bathroom, and to use what feels right and or safe. I was wondering if you agree with that point of view, or if you have additional insight or a different take altogether. Thanks. So first, tough, right? Because right, accessible and individual bathrooms or gender neutral bathrooms are still very difficult to find. Your friend and your friend's therapist are absolutely correct. There is no one right bathroom designation. Because you identify as non-binary, you are truly welcome to use any one of the bathrooms, whichever one makes you comfortable and whichever one makes you feel safe. Ideally, we would all move in the world to a place where we have more gender neutral bathrooms or more accessible private bathrooms, but we're still very much behind on that. In the meantime, definitely what makes you feel more comfortable. Definitely what makes you feel safe. Safety is very, very important. But there isn't going to be one or another. There's just going to be the one that you feel, again, the most comfortable with. And I would say just go ahead and use it as long as you feel safe. And your friend and your friend therapist are absolutely right. There is no one particular bathroom for, unless we're talking about gender neutral bathrooms. So yeah, go ahead and use it as long as it makes you feel safe and comfortable. Next question. So I guess a question I have is about bottom dysphoria. So in this case, we're talking about genital dysphoria. I feel like some days I'm okay, can tolerate, look, and touch and what I have down there, and other days I really don't want to look at what I have down there. Days where looking down there can cause me a feeling of dread and sadness, and it can make me cry, wishing I had the correct equipment. Can bottom dysphoria fluctuate between really mild to severe, or does it eventually get worse over time? I have just recently started to experience what I'm calling bottom dysphoria. Sometimes it can even make me dissociate, but not at all times does this make sense. Makes perfect sense. Incredibly, incredibly common to have bottom, in your case, genital dysphoria. And having genital dysphoria will cause dissociation. That's also very common, especially during intimacy, especially during any type of bodily intimacy where you're naked and you're vulnerable and you have to expose your genitals and you're not comfortable with your genitals. Therefore, you may potentially use dissociation as defense in order to withdraw, in order not to be present, in order not to feel the dysphoria at a moment. So just the way it's written is indicating to me that you're probably really struggling with this because you're using the language down there without really naming the genital area. And a lot of times when it's very difficult for people to discuss genital dysphoria, they can't even name the body parts. They can't even say, my penis makes me uncomfortable or my vagina is making me uncomfortable. They can't even really name it. Not being able to name your genitals is also a good indication that the dysphoria, chances are, is quite severe. People who have a more mild dysphoria are able to verbalize it, they're able to express it, the more severe it is, the harder it is going to be for an individual to talk about it. Can it fluctuate? Absolutely, it can. In fact, I have a video on this where I talk about when individuals don't have any genital dysphoria, and then all of a sudden their gender dysphoria tends to increase and spike up. Very common. Dysphoria in general, any dysphoria to any body parts will fluctuate. That's just very common way. I don't want to say natural because there's nothing natural about gender dysphoria, but that's just the way gender dysphoria tends to move. Gender dysphoria has no logic to it at all. It's not susceptible to logic. There's no patterns. You can start exploring your gender and feel no genital dysphoria, only to find out as you explore, you do have genital dysphoria. You can start out having genital dysphoria, and as you explore and you do other things to realize it tends to decrease. So again, there's no logic to it. And this is the most difficult and frustrating things for a lot of you, is because there is no logic for it. Then you're wondering, well, how can I deal with it when there's no even pattern? One day it's better, another day it's even worse. One day it's gone altogether. So how do I know what's real? And this is the challenge with dysphoria, but it does and can absolutely fluctuate. And it also will fluctuate on a lot of numerous factors. It can fluctuate from the fact that you are just stepping into intimacy and you're vulnerable and you're touching on a body part that's already making you uncomfortable, to you have to look at yourself naked and it's making you uncomfortable, to you have to go to the bathroom using your genitals. It can fluctuate because you are on hormones and you haven't taken your dose of hormones. Lots of things can cause fluctuations in dysphoria, including daily stress. So hopefully that answers for you. I will try to remember to link the video I mentioned below for you to watch as well. Next question. I'm 75% of who I am. Okay. How do I make the leap? That's what I'm wondering. Okay. So, like I always say, people seldom are 100% sure. People may be closer to 100% in knowing they're trans, but they may still not be fully sure to take that leap forward in terms of transition. I'm hoping that what you mean by taking that leap forward is leap forward toward your true self, whether it is coming out, starting social transition, or starting to socialize. So the truth is, it's not a matter of having a particular percentage to be able to take that leap forward. Leap forward is a lot of times is about just doing. Now, the way you can help yourself to offset the fears that you're experiencing, anxiety and resistance that you may experience with taking that leap forward, is taking small steps. Smallest steps. You don't want to jump into medical surgical when you're experiencing what you're stating in here, when it feels like you're having anxiety and resistance. What you want to do is you want to take small steps. You want to start off with, for example, social transition, maybe just coming out, maybe on expressing your pronouns, expressing your name, maybe then trying to modify your gender expression, modify your gender role. Each step should ideally make you feel more affirmed. And therefore, as you feel more affirmed, you should feel more confident. The more confident you feel, the more likely you're going to be able to move forward. And hence, you don't really need to make a giant leap. It's not about diving in a deep end of the pool, but it's about stepping in the shallowness of the pool. And each step, as you're walking forward towards the depths, you're feeling more and more and more comfortable. So that's what I would recommend. Start with little steps and allow yourself to build up on those little steps. All right, so we are at our final question for today. What should one do if they're too scared to continue to transition, but has pervasive gender dysphoria? This is a tough one. I'm genuinely terrified of the journey and of being a woman, but I hate being a man and feel suffering because of my body. I feel trapped. Every decision feels miserable. God, my heart really goes out to you because it is so tough, and anybody watching knows it is so tough when you have that strong gender dysphoria, you describe pervasive gender dysphoria, but have this paralyzing fear to move forward. So you're saying too scared to continue transition. You're implying that you're already in some element of transition. this is what I'm going to honestly say. For some individuals who are struggling with dysphoria and pervasive gender dysphoria as you do, there comes, for some of you, there will be a crossroads of moving forward is too terrifying and overwhelming and scary. At the same time, staying where you're at is also painful and terrifying and scary. Both of those are going to be terrifying and scary. In other words, you find yourself at a crossroads and you're realizing that each one of the paths are equally as scary and terrifying. How do you even decide which one to take? What I often suggest people to do is first look, if you were to choose to remain where you're at and not continue to move forward, how long have you already been living with your gender assigned at birth? Now, I don't know how old you are. Usually people in this situation are older. Usually they have lived with their gender assigned at birth for 20, 30, even longer. And when I ask this question, usually people say, oh God, that has been really challenging. So what I usually say is, okay, so if you've already been living with pervasive gender dysphoria for this long, you already know how living with it is going to continue to affect you. And people usually say, yes, it will continue to be the way it is now. It's painful. I have to cope. I have to utilize a lot of even unhealthy coping. And it's miserable and it's heartbreaking. It's causing me depression, anxiety, and a whole bunch of other things. Okay. So we know if you take the path on one side, you already know exactly where it's going to lead, right? Because you have experiences of walking this path. Now, the other side, the transition side, is terrifying, is scary. It is true, you don't know how it's going to plan out for you. You don't know if this other path is going to give you benefits, if it's going to make things better. You have no idea. At least the way you say it, you don't know. But nonetheless, we also have to agree that this path, because there is the unknown, also has a potential for making things better. This is like gambling in this case. So you don't know if it's going to make things better, but you also don't know if it's going to make things worse. And in that case, I think it's worth taking the risk or steps forward versus maintaining the path which you already know how going to continue to unfold for you. Now, as I said before to the person who is 75% sure but still doesn't know how to take a leap of faith, the same thing applies in this case. You continue to take small steps so that you can assess that this path, even though it is still terrifying and scary, and chances are it might continue to be terrifying and scary for you, but it starts to bring you little rewards, even if rewards are tiny. Even if rewards is, hey, I notice my depression is starting to decrease. Hey, I notice I'm sleeping better. Nonetheless, that's still better than the other option. This is why I love, love, love small steps, because they build on each other. And as they build, you change internally as a person. You become more confident, you become more comfortable, you become more affirmed. You start realizing that even though this is scary, this has a possibility of the future, because you're starting to accumulate those little breadcrumbs of the future in the way of those little steps. So that's what I would recommend, because for a lot of adults, and I'm assuming you're adult because my channel is for adults, when you are in this position, again, ask yourself, okay, what do I know? And what you do know is that if you continue living in your assigned gender at birth, you already know how that's going to unfold for you. But this you don't know. And I think it's worth trying in a safe way and see how it's going to pan out. So that would be my suggestion. So those are all fantastic 5 questions. I have a lot more. I will try to do this release of these videos every Monday as long as I have questions. If you have again specific questions, just comment below, ask me below, or email me directly, and I will make sure to include them in the series. Otherwise, comment below, let me know what your thoughts are. And if you have any feedback for this individual for any specific questions, and I'll see you all next time. Bye.